Hello. Well, this is a little bit later than expected, and as you see, I'm not in my car. When I uploaded the first video I made, it was only 10 minutes long, and you guys know me. Probably never made a 10-minute video in my life. I talk way too much. So, what seemed like it happened was my work laptop got full, and it just decided that it was done recording. So what I uploaded was like the first 2 slides. So anyway, we're going to do it again. We're going to do the whole thing. All right. So the Bernoulli Principle. What happens to... something's wrong here. There we go. What happens to a fluid when the tube it's moving through, reduces in size? Well, the speed, what does it do? Either increase or decrease. What do you think? That's right. It increases. The speed increases because to get the same amount of fluid, which could be air, right? It could be water, it could be air, whatever, it doesn't matter. Get the same amount of fluid through the opening. If there's not as much space, the speed has to increase. So this is all going to get like squished down. It has to go faster. What happens to the pressure in all non-movement directions? So in every direction that fluid is not moving, does it decrease or increase? It decreases. Okay, cool. So one of the things that can happen here is if you are if you have a little straw in each of the places, like, so you have a tube going along, and here where it's large, you have a straw, and you can see there's a level of water or whatever. Then there's a constriction, you have a little straw, and you're gauging the level there as well, and then it comes up, and you can gauge the level after the constriction as well. The level of the water at the constriction is going to be way lower than in the other 2 sides. And that's because the pressure in all the other directions that is not the movement direction is lower. Because all of that pressure is going towards moving through the constriction. So what happens when the size of the tube enlarges again? Well, speed decreases, and the pressure in all directions, especially backwards. I don't mean especially like the backwards pressure increases more than all of the other directions. It all increases back to the same because it's still moving forward. It's just not moving forward as fast. So the pressure in all the other unintended directions increases to the same amount. I mean especially backwards because this explains one of the ways that the vocal folds are going to be pushed back closed by that other pressure from this fluid now. Comes through the constriction very quickly, then it gets here and it slows down and it pushes the vocal folds closed again. How does the Bernoulli Principle aid in creating phonation? Well, shoot, I just gave it away. It pushes the vocal folds closed to make puffs of air. But what else aids in vibrating the vocal folds during phonation? I think that I will put in a small gap here so you can consider these. But what really you should do is pause the video. And I'll put in less of a gap now that I've said that you should pause the video. Well, elasticity is one really important thing. The vocal folds are, very elastic. So they're pushed together. And as they get moved a little bit apart, they want to come back closed. This reminds me of when we're talking about breathing. One of the things that makes us exhale, if we're not using muscular exhalation, is just the tissue wants to go back the way it was. It's stretched out, so it wants to snap back to the form that it had. This is true for the vocal folds as well. Also, vibrations. So a vibration usually doesn't just occur once. A vibration occurs over and over again. One cool thing about me not being in my car is that I can show you my tuning fork. I'm only going to hit it once, and it works best on the back of my head for some reason. So I only have to hit it once. And the vibration continues. You can't see it, so it doesn't matter if I... Ow. Doesn't matter if I put it up on the camera, but you can hear it. So the vibration occurs over and over again. It's a vibration. It's not just a transient movement. And that's true for the vocal folds as well. It may dampen over time. So if you just went, there's a little bit of vibration going on in there. If you're making a sustained tone, then it's keeping the vibration going. But even with one transient little noise, the vibration is going to go on more than just one opening cycle, because it's kind of set into a vibratory motion. And then also a little bit of gravity too, because the vocal folds are being pushed upwards by the air moving through them, so gravity is going to affect it a little bit. But of course you can still talk if you're upside down, so that doesn't have as much of a part to play as Bernoulli Principle, elasticity, and just the vibratory mechanics of the vocal folds. Okay, how does the periodic, which is actually quasi-periodic like we talked about earlier today, how does that movement create sound? Well, it creates puffs of air, right? So that opening and closing is going to create puffs of air, and those puffs of air create a sound pressure wave. The open phase is the, oh no, my words, why does this happen to me so much? Compression and rarefaction, there we go. So the puffs of air create compression and rarefaction. When it's open, it creates an area of compression. When the vocal folds close, it creates an area of rarefaction. There are less air molecules in that area, so you could say air molecules are more rare, so rarefaction. So then that compression and rarefaction is a wave that then travels out of the mouth and through the air as a sound pressure wave. And once again, I've given away the next question that I ask here. How does sound travel through air? It's a sound pressure wave. Cool. Is sound produced by the vocal folds a sine wave or a complex tone? Well, so first of all, when we talk about the different modalities of voice, we're talking about modal voice here. I know that that's not a perfect sine wave. So we should say a near sine wave. Is it a near sine wave, just one frequency, or is it a complex tone? Is it made up of harmonics? That's the real question I'm asking. The answer is it's a complex tone. It's made up of multiple harmonics. You have the fundamental frequency and then some harmonics. And what is the harmonic series? Yep, exactly. I don't actually know if you got it right. Just go with it. It's 1, 2, 3, 4, 5, 6, 7, 8, 9, etc. Right? So the first harmonic is the same thing as the fundamental frequency. It's one times the fundamental frequency, so that's why the first harmonic. It's the same thing. It doesn't matter. It's okay. So let's say it's a 100 hertz tone. Then the fundamental frequency is 100 hertz. The second harmonic, 2 times the fundamental frequency, is 200 hertz. The third harmonic is 3 times the fundamental frequency, which is 300 hertz. So all of your harmonics would be 100, 200, 300, 400, 500 hertz, and so on. That's the harmonic series. And to relate it back to the question before, the buzz in here, the laryngeal buzz that we produce, is a complex tone. It produces a fundamental frequency and harmonics as well. How are harmonics created? Which I don't really mean like how are they created, sympathetic vibrations of the source. What it means exactly is, I'm not going to ask you to define this in the exam. You just need to know this information. But essentially, vibrations with faster vibrations or with a shorter wavelength that are longer than the longest possible vibration. So we talked about this with that kind of wobbly, large sine wave. So the vocal folds have a certain length that they are based on the configuration that you have at any given moment, right? So they're able to vibrate at 2 times the length that they are, actually, because they can go. So a full wave cycle is going to look like up, back to the midpoint, down, back to the midpoint. So the vocal folds can actually vibrate at like 2 times the length that they are, because you could have half a wave. You could have half a wave represented with the vocal folds. Then they'd move and go downwards. So you could have, half a wave here, and then half a wave here as it goes back and forth. But you could also have a full wave. You could have 1.5 waves. You could have 2 waves, and so on. Anyway, all of those harmonics are just going to be more and more vibrations in the same space as the actual length of the vocal folds. Essentially, it's just faster vibrations that are faster than the lowest possible sound, or shorter wavelengths than the longest possible sound. That's it. Okay. Why is it important that there are harmonics for speech? This is really banging right up against speech science. So this is as far as we're going to go into speech science here, but this is, necessary to know for that class. You'll have a leg up when you get to that one, or if you're already in it, you probably already know this. It's important that there are harmonics for speech because these harmonics are the things that formants are going to form from. So the articulators, the resonators, the resonators, not so much the articulators, but the resonating cavities in the mouth, so the pharynx, the oral cavity, the nasal cavity, are going to accentuate and dampen, essentially make stronger or weaker these harmonics. And so one of those harmonics is going to become the formants that we actually use to hear the difference between an ah and an oo and an e, and other vowels as well. Okay, so let's talk about frequency and stuff. What is pitch? No, that's wrong. It's the perception of frequency. I mean, again, I don't know if you got it right or wrong. I'm just going to make up a story in my mind. Pitch is the perception of frequency. It's what we experience. So there is a frequency. It could be a piano note. It could be someone singing. It could be someone speaking, whatever. But there is a frequency. There is a number of cycles per second. And pitch is our perception of that frequency. Usually they're the same. But like we talked about, there are things that can happen that change our perception of frequency, and the actual frequency is different. But anyway, it's the perceptual component of frequency. What is F0? It's the lowest frequency in, a group of sounds that you're measuring. It's the fundamental frequency. It's the frequency that gives rise to all the harmonics. So the lowest frequency in a series of harmonics is the FO. What is loudness? That's the perceptual component of intensity. So there is an intensity. It's a certain number of dB, and we experience that as something else. Again, it's usually the same thing as actual intensity. Our perception of loudness maps really well to intensity, but not always 1-to-1. Whoops. Gave away the next answer. What about larger cross-sectional mass? Does that create a lower or higher frequency? Well, more cross-sectional mass, if you imagine a vocal cord that's real thick, is going to create a lower frequency. So more cross-sectional mass, lower frequency. You can relate this to the fundamental frequency of voices as we age. Children, doesn't matter what gender they are, they're going to have the same fundamental frequency. But hit puberty, then you're going to have the more testosterone that's introduced to the vocal folds is going to increase the size of the vocal folds. So then you have boys with a lower frequency than girls. And that's because of this increase in cross-sectional mass. Okay. Whoops, I gotta stop giving away these answers. What about tighter or looser vocal folds. Which one is going to create a lower sound? A looser vocal fold is going to create a lower sound. So if you have less distance between your thyroid cartilage and your arytenoids, or cricoid cartilage, you could think about it either way, less distance, then you're going to have a lower frequency. Think about that like a rubber band. Certainly I've got a rubber band around here, so I don't. What kind of office is this? Anyway. So what happens to vocal folds? The heck am I talking about here? What happens to vocal folds for some very high-pitched singing? I'm just going to get rid of that because I'm not going to ask that question. But what actually happens here is there's a reduction of use of the amount of vocal fold present. So instead of vibrating along the entire length of the vocal fold, what happens is some singers will only use a smaller portion of their vocal folds, and this allows them to create an even higher pitch tone. Mariah Carey is one of the singers who would probably only uses a very small amount of her vocal folds to get those really high whistle tone pitches. So anyway, that's the answer to that question. I was going to take that one out of there, but whatever. Now you know the answer. Okay, so here are some movements of the larynx. These are very important. Probably multiple questions about these. Also, these are words that you're going to need to know because they're going to be present in questions about other things too. Adduction, what does that mean? It means moving the vocal folds together, like adding them together. Abduction, then, is the opposite. It's like moving them away, like if someone is abducted by killers or aliens or killer aliens. And then swallowing, what happens in this sort of movement? Whoops. The larynx is pulled upwards and out of the way of, the food bolus or whatever you're swallowing. Okay. So let's take a look at this diagram here. What are these parts? So I'm just going to hover over one. I'm going to ask you what it is, and then I'm going to tell you what it is. What is this? This is kind of a funky drawing of it. We talked about these just a little bit. They're the corniculate cartilages because they're going to sit right on top of these right here. These kind of A-shaped candy corn type things, which are the arytenoids. Good. And the arytenoids, so the corniculate cartilage sits right on top of the arytenoids. The arytenoids sit right on top of this cartilage, which is the cricoid cartilage. Great. So those kind of all come together like a transformer. And then you've got this part that sits on it and hinges against that structure. It's this. What is this cartilage? That's right, it's the thyroid cartilage. Great. This, it looks like a wad of gum, but it's actually the epiglottis. And then this one is the only bone in the larynx. It's also the only free-floating bone in the body, and it's called the hyoid bone. Okay, so some important things to know about these. Number one, these are the superior cornu. These are the inferior cornu. This is the laryngeal or the thyroid notch right here, the thyroid prominence, and you learned in the lab that this is the thyroid angle right here. This is the laminar part of the thyroid cartilage, and over here on this side, it's kind of tilted away from us. That's the laminar part of the cricoid cartilage. The thyroid cartilage and the cricoid cartilage come together here on the inferior cornu. So that's the inferior cornu of the thyroid cartilage is going to sit roughly right here on the cricoid cartilage. There should be a facet here, but this picture doesn't have it. All right, so then it's this is going to tilt on that axis right here. All right, good. That's it for this diagram. But this diagram, if you need further help with this one, try out those matching games that I have, the Purpose Games website. There's a lot, well, there's one, which you can take multiple times on these structures. Okay. Here's the thing, though. On your exam, you're going to have a picture that looks like this, but there's going to be muscles on it. It's pictures that we've used in, I believe, Phonation 2 and 3. So if you know what the structures are in Phonation 2 and Phonation 3, you're good. The reason why I'm using pictures from both of those is because I might be asking you to identify a ligament. I might be asking you to identify a muscle. Phonation 2 looks at ligaments. Phonation 3 looks at muscles. And then Phonation 1 looks at just the cartilages, but you can see those in the others as well. So study phonation images from Phonation 2 and Phonation 3. And like, you know, put those together in your head with the pictures that they have in Purpose Games, which aren't the same images that we have. I should make one that use the same images that we have. And if I have a little extra time tomorrow, I will. Okay. So let's talk about them joints. Cricothyroid joint. What ligaments are present in the cricothyroid joint? There's 3. Yes, good. Exactly. It's the anterior, lateral, and posterior cricothyroid ligaments. Anterior and posterior, these make sense. They're on the anterior side of the joint. They're on the posterior side of the joint. Lateral is a little weird because they're not exactly so much lateral as they are on the bottom of that joint. Remember that? Kind of like on the very bottom of the inferior cornu connecting to the cricoid cartilage. That's the lateral ligament. What possible movements are there for the cricothyroid joint? Well, there's one obvious one, which is rotating around that joint. Rotation about the inferior cornu axis, but also gliding is another movement that can happen on that joint. And what is the major consequence of either of those movements? A frequency change. That movement of the cricothyroid joint is mostly what's contributing to frequency change. Overall, most of the variance is taken up by the movement of the cricothyroid joint. Okay, what about the cricoarytenoid? What ligaments are there on the cricoarytenoid joint? There's only 2. In this case, it's the anterior and posterior. There's no lateral ligament. There's an anterior and a posterior. So an easy way to remember this is they both have an anterior and posterior. The cricothyroid also has a lateral ligament, which is at the bottom, not the side. Okay, what are some possible movements of the cricoarytenoid joint? There are 3. Rotation about the middle of the arytenoid, right? So if this is your arytenoid, it's about in the middle. It's rotating on the cricoid cartilage, right? So there's 3 movements of the cricoarytenoids. This joint, this particular joint, the cricoarytenoid joint, movement on that axis like this is going to give you just that rotation. But we'll talk about the other 2 movements when we talk about the muscles of that area. So keep those 3 movements in mind. This is the rotation, and then there's 2 more. Okay. What's the major consequence of rotation about that axis? Well, it's vocalization or free breathing, right? Because what you're doing... Is that right? There we go. So what you're doing is you're either bringing the vocal process of the arytenoids together, which is going to, the vocal folds are coming up from here onto an imaginary thyroid cartilage up here. So rotation on that axis is going to bring the vocal processes together, which is going to allow for vocalization, or it's going to bring them apart, which is going to allow for free breathing without any, hindrance of the vocal folds in the way. Okay. The cricothyroid membrane, where is it? It moves up along the trachea toward the cricoid and thyroid cartilages. And why is it important? Is it just important because it's a membrane? No. There's another reason. The free upper margin forms the vocal folds. So this is it kind of moves up, covers the inside. And then as it gets to the top about here, that free upper margin comes in, and that's the vocal folds. What about the quadrangular membrane? Where's it? Now, that's right. It moves downwards from the epiglottis down. And why is it important? Because it forms the vestibular folds, exactly, or the false vocal folds. So it's moving down, and the free lower margin of it creates the false vocal folds. What's the space between the true and false vocal folds? Yes, exactly. It's the ventricle. And also, now I want to know the function. Why is the ventricle important? Yeah, it houses all those mucus-producing cells, right? So it produces a lot of mucus to hydrate and lubricate the vocal folds. This is important because what we just talked about recently is nodes, vocal nodules, right? So it's important to have these mucus-producing cells there so you keep your vocal folds happy and healthy. Okay. What is the big difference between intrinsic and extrinsic muscles of the larynx? Well, intrinsic muscles are within the larynx. Usually they function directly on laryngeal function. Gosh, that's a stupid sentence. What I mean is they're directly responsible for the things we've been talking about. Changing pitch, changing the fact that your vocal folds are together or not, right? Extrinsic muscles, these connect on one end to the larynx and on the other end outside the larynx. Intrinsic, everything's within the larynx. Extrinsic, there's one connection from outside the larynx and then one connection on the larynx. They usually help stabilize the larynx. So some will come down and stabilize against the chest. Some will come up and stabilize against the jaw, the floor of the mouth, the tongue. Okay, what about the thyroarytenoid muscle? What's the internal portion of the thyroarytenoid muscle? If I show you these two fingers, does that help? Or maybe like this. So the thyroarytenoid muscle might look like this. The internal part is the vocalis. Right? This is the thyroarytenoid muscle. This is essentially what we think of as the vocal folds, right? So if we have the thyroarytenoid muscle, and then the vocal ligament is right here and right here, then these are the vocal folds. And this internal portion, that's the vocalis, and the external portion is the thyromuscularis out here. This is a little bit more important, but the internal part is the vocalis. They're both important, but in terms of questions on the exam, the vocalis is more important. Okay, what about the posterior cricoarytenoid muscle? What does it do? Well, maybe it would help if I did this thing again, right? So the posterior cricoarytenoid muscle, you can think of it hooking on right here, and it kind of moves a little bit backwards towards the laminar portion of the cricoid cartilage. It's going to pull like this. So it's going to give you abduction of the vocal folds. The lateral cricoarytenoid connects to the muscular process, just like Posterior connects to the muscular process, comes down. The lateral connects to the muscular process and goes lateral to the top edge of the cricoid cartilage, which should be somewhere roughly here. It's going to move up. So then these are going to pull towards each other, and that's going to cause adduction of the vocal folds. There are 3 arytenoid muscles. Do you remember what they are? There's really only 2, but one has 2 parts. They are the transverse arytenoid, the oblique arytenoid, and the aryepiglottic muscles. Okay, what does the transverse arytenoid do? Do you remember? It helps glide the arytenoid cartilages together. So it's kind of like a band. Imagine a rubber band, which again, I don't have in here. I don't know what the hell's going on with my office. Who doesn't have rubber bands? Anyway, so you've got these arytenoid cartilages. I can't figure out a good way to... Yeah, that works. So here's arytenoid cartilages. The transverse arytenoid muscles are going to come across like a band between the two. It's going to glide them together. So it's going to like kind of squeeze them towards each other. The oblique arytenoids, those are, what shape are those in? Kind of like an X, right? They go crisscross on them. So here are these, they're going to go like this. Well, what does it do? It tilts the tops of the arytenoid cartilages towards each other. And the aryepiglottic muscle, I have 2 questions for you on this one. First of all, what the hell does it do? Second of all, what is it a part of? I mean, the aryepiglottic muscle connects to what other muscle? Connects to the oblique arytenoids, right? So it kind of looks like a little loop. Somebody said those, the cancer ribbons or any of those disease ribbons or bring home, well, any ribbon. There's so many causes. There's always ribbons. Anyway, it looks like one of those ribbons, right? So it kind of goes, if this is the epiglottis, it's going to come up and around and down like that. That's the oblique arytenoid and aryepiglottic muscle together. Across, around, and down. So, we know what the oblique arytenoid does. What does the aryepiglottic portion of that muscle do? It's kind of obvious, right? It's going to pull down on the epiglottis. Cool. If you remember, what helps move the epiglottis? One thing is the aryepiglottic muscle. It's going to pull down. One thing is the movement of the larynx. So as the larynx gets pulled up, it's pushed down a little bit. And also the back of the tongue can come backwards and push down on the epiglottis. And then, you know, as we've said, some anatomists think that that's enough to get the epiglottis to close. Other anatomists think it doesn't quite solve the entire puzzle. So there may be another force at work there as well. Okay. Yeah, okay, we answered that one. What about the cricothyroid muscle? There's 2 parts to this one. Do you remember the names? A hint is it starts with pars. Pars rectus and pars oblique. Now, of course, these are both on the cricothyroid joint because they're the cricothyroid muscles. The cricothyroid joint is the one that we talk about where there's motion, this kind of rocking motion. This is responsible for changes in frequency, you know, lengthening, tightening the vocal folds. But there's a slight difference in function of the rectus and the oblique. One changes pitch in a different way than the other one. If you remember the 2 different motions that we have on this joint, that might help you. So there's rocking or rotating, and then there's gliding. Which one is responsible for which? Well, the pars rectus is the one. So oblique, we know oblique is on the sides, right? We've got obliques are here on the sides of the abdomen. We've got oblique arytenoids, which are the sides of that crisscross one. We've got the pars oblique of the cricothyroid muscle, which is on the side of the cricothyroid joint. So it's going to be pulling. Let's see. Here's our joint. The oblique, the pars oblique is going to be over here, and it's going to be responsible for gliding. The pars rectus is in front here. You can think of it kind of like the abs for these two cartilages. So it's going to pull down. It's just going to tilt on that axis, rotate on that axis, right? So the pars, let's see, I've got the answer here. Rectus rotates and oblique glides. I can't make oblique glides sound good, but rectus rotates, not too bad, right? That should help you remember. So rectus rotates, oblique glides. Rectus, again, is kind of like the abs. If you think about this like having abs, rectus is going to be right here. It's going to rotate. And oblique is on the sides. It's going to glide. All right. What are the sternothyroid, thyrohyoid, and inferior constrictor? You remember those? What are they? They're muscles, obviously. But what kind? They're extrinsic muscles. So if I ask you about, which ones are these? They're extrinsic muscles. What do these and other extrinsic muscles do? Well, they stabilize, which we already talked about, and then a lot of these ones that connect upwards towards the tongue and the floor of the mouth, they're going to lift the larynx for swallowing. Okay, let's keep going. What about non-speech movements? Tell me about coughing. What happens with coughing? How do you cough? Well, you take a large inhalation, then you have tight adduction of the vocal folds. So this is going to be putting together a little bit of information from this time and last time, right? So you're going to use all of the muscles of inhalation, and then you're going to put tight adduction of the vocal folds. So, and then you kind of choke it off right there. You have like tight adduction of the vocal folds, and then you have forceful contraction with the exhalation muscles. Like that. You can feel it. I mean, go ahead and do it. You're probably in your house. You're probably not on public transportation. Probably not a good idea just to start coughing on public transportation right now. I don't know. Or maybe you don't want people to sit next to you. Maybe it's a good thing. In that case, you're welcome. But so you can feel, you can make yourself cough. Of course, everybody knows that. But you can feel. And think about the muscles when you do it. You can feel them. You can feel them all contract at once. The abs, the obliques. You can feel some tightness in here. Everything's contracting. So then what's going on is the junk that you're coughing out is pulled towards the center by those Bernoulli forces. The air pressure that's coming out between the vocal folds has a lot of forward movement. There's not a lot of pressure in any direction but forward. So what that does is it effectively sucks all of the mucus and other stuff towards the direction that the air is moving. Then once it gets into the direction of that force and in that direction of the way the air is moving, then it's just carried by the air out. So it brings it together and shoots it on out just with the force of the cough. It's actually really cool, right? I mean, It's pretty cool how coughing works. Okay, how do we... Whoop, I gave it away again. Dang it. How do we get sound from the ventricular folds? The false vocal folds. It's pretty much, similar to the actual vocal folds. Kind of like that. I don't know. I'm not going to keep doing that. But if you're on the bus, go ahead and try it. So you get vibration that's similar to the vocal folds because you do kind of have this sort of periodic motion, but it's less periodic, it's less harmonic. That should say less harmonic. I meant less periodic and harmonic, comma, but less periodic, less harmonic. Okay, and then what is the function of the epiglottis? It's a pretty easy one. Little softball question, right? It protects the trachea during swallowing. Closes it off so nothing can come in. Remember that for when we talk about swallowing. That's going to be important, especially when we talk about disorders of swallowing. Okay, let's talk about types of speech sounds. What's turbulent noise? Well, in this case, we have a partially adducted vocal folds, which kind of causes the air to rasp around in there. Like that. You can kind of hear it. We talked about the lady with the abductor spasmodic dysphonia today. And so her vocal folds would open a little bit, not all the way, and so you'd get a little bit of this turbulent noise while she's speaking. So, hi, like that, kind of like that. It's really hard to imitate these things. Normal speech, different types of normal speech. Modal, what is that? What does that mean? That's just your typical speaking voice. It's quasi-periodic. It's not exactly a sine wave, but it's close. What about the loft or falsetto? Ooh, like that. That probably is a little bit too low, but whatever. It's fine. That's high-pitched. It's the higher-pitched register that you can sing or talk in, especially if you're Mrs. Doubtfire. And it looks most like a sine wave, right? If you look at had the opening and closing periods of the vocal folds, it's very much like a sine wave. And then what about vocal fry? What does it look like? It's even less periodic, and it's very poppy. Like you can hear it kind of popping. We didn't talk about this in class. I wanted to, but it kind of, we we're a little bit pressed for time. But an interesting thing about vocal fry is some people find it annoying, but you shouldn't. If you're one of those people, you shouldn't find it annoying. What seems like is going on here is it may be a response. It's typically done by, oh, that's interesting. The pipes in my house are making noise. Ghosts. Nah, just kidding. It's probably termites. So it's typically women that do vocal fry. Not only. It's by no means only a female trait. That's not true. But it is. There's more women who do it than men. More women who do it than men. That sounded like a weird sentence when I said it. But it seems like it may be that women who are in positions that are more powerful tend to vocal fry a little bit more. And if you think about vocal fry, it kind of brings the pitch down a little bit. At the end, makes things sound even more like a statement. It's kind of the opposite of what people used to call like Valley Girl speech, where everything kind of went up at the end. And that tends to set you up for being like kind of, that questioning aspect to that kind of speech kind of sets you up as being like maybe a little submissive. And so the vocal fry is kind of like doing exactly the opposite thing, where instead of being submissive, you're being more dominant. And so it seems like women who progress further in careers tend to use vocal fry a little bit more. It's possible because as they use this, it's a way to be more assertive with speech, because as probably class that's mostly full of women, there's some inequality in job places, right? So men seem to be favored a little bit more than women. So it's possible that the vocal fry is a way to give them a little bit more of an edge and to seem a little bit more dominant and compete with men a little bit more. So anyway, don't think vocal fry is annoying, or at least just think it internally, because it might be useful. Okay, so how does your voice change through the lifespan? We kind of talked about this already at the very beginning, but at puberty, male voices deepen due to increased testosterone. As you age, the tissue kind of loosens up a little bit, so women's voices get a little bit lower. And then also, older men start to have decrease in testosterone, which then has the effect of decreasing the cross-sectional mass of the vocal folds, so their voices get a little bit higher. So the voices kind of come back together. If you talk to like super old people on the phone, sometimes you're not totally sure what sex they are, right? All you know is like old. I'm talking like 80s, 90s, right? You hear it and they're like, hello. And you're like, I'm not sure if this is an old woman or an old man, but I know they're old. And that's kind of that function there, of that fundamental frequency is coming back together now that these sex hormones aren't exerting their difference anymore. And also the women's vocal folds are getting a little bit looser due to age. Like I said, men's vocal folds will get also looser due to age, but the testosterone is a larger effect, so overall it's going to lead to an increased fundamental frequency. Okay, what about this long slide? What is a laryngoscope? What two different kinds of laryngoscope are there? There is a rigid and flexible endoscope. And the flexible goes right up the nose, up through the nasal passage, looks down the throat at the larynx. The rigid one goes in the mouth. It's hard to talk. So the flexible endoscope gets you a lot clearer picture of what someone's actually doing when they're talking. What are measures that we want to look at for vocal fold movements? We want to see what do the edges of the vocal folds look like. We want to look at the vocal fold mobility. We want to look at the overall health and color of the ligaments and folds. Can you see blood? Is there swelling? Is there just general discoloration? These kind of things can give you an idea of the overall health of the vocal folds. What are vocal nodules? Or nodes? Either way. They are callus-like bumps from overuse. And one thing that you can do to get rid of them is vocal rest. And if they don't go away with vocal rest, there is a surgery that you can have. You can have them lasered off, or they can basically take a cheese grater to them. No, I'm kidding. It's usually just lasered off. You can get rid of them that way. And then you have to do vocal rest after that as well. What about Reinke's edema? It's a swelling of the non-ligament portion of the vocal folds, usually associated with what activity? Smoking. Exactly. It's not necessarily cancerous. It's just a swelling of the tissue. Laryngitis. It's a swelling of the vocal ligament. Swelling and stiffening, I should say. What happens with intubation? We actually didn't talk about this in that lecture, so I'll tell you now. Intubation can occasionally rupture the vocal ligament. I say vocal folds, but it's the edge of the ligament that it can rupture. What that means is it's not like it's totally ruptured. What I mean by that is it ruptures the blood vessels in there, so you can have a swelling of blood on the vocal ligament, which can cause it to be stiff. It can cause you to sound a little hoarse. Your vocal folds can feel kind of stiff from that. Occasionally, it can be somewhat painful. And then also, bad cases can cause temporary paralysis of the vocal folds as well. So if there's too much swelling, you can end up with paralysis of the vocal folds. They can't open and close as well. What about spasmodic dysphonia? I kind of gave that away also. What types of spasmodic dysphonia are there? Well, there's abductor, adductor, and tremor. And they're just unintentional movements of the arytenoid cartilages. So by that, I mean they're unintentional spasms of the muscles, the cricoarytenoid muscles. So, and tremor, so abductor and adductor dysphonia are unintentional spasms of the cricoarytenoid muscles, but the tremor type is unintentional spasms of the cricothyroid muscle. That's a little bit more in depth than you need to know, but that's okay. You should be able to figure it out just by thinking about the tremor kind of changes pitch a little bit, and abductor and adductor change the the relationship of the vocal folds to one another. So abductor dysphonia is going to be the vocal folds move apart unintentionally. Adductor dysphonia is going to be they tense together unintentionally. And tremor means that there's a wobbliness to it. Sometimes in pitch, sometimes just a wobbliness to the arytenoids. Either way. So it can cause any kind of tremor like that. And then another thing that can happen is arthritis of the cricoarytenoid joint. We talked about that. It's bad stuff. Essentially, it's what it sounds like. The cricoarytenoid joint can become, arthritic. There's some swelling in the cartilage. It doesn't allow it to move as well as it should. With the person that I was telling you about, that paper that they wrote recently, they gave her an injection of, I think, a steroid injection, and it worked temporarily. I mean, first of all, an injection into the larynx does not sound like fun. But secondly, it's arthritis. It doesn't really ever go away. There's not a good cure for it. So it's just managing arthritis rather than curing it. So it helped. The injection helped take care of it for a while, and I think it ended up coming back. So I don't know what, I didn't follow up and see if there was another paper written about any other procedure that she had to resolve that. This was just the preliminary paper on like the fact that this exists, which is scary, but good that we know about it, because now there may be other patients who have similar problems, and now you know about it as well. Okay, that's the end of our review. The test is going to go up Friday at midnight, or morning midnight, like Friday, really early Friday morning, basically. And then it's going to close on Sunday at midnight night time. God, this is so confusing. It's going to close Sunday night. It's going to open Friday morning. It's going to close Sunday night. Anyway, so you have basically 3 days to take it. As usual, you have to turn on your camera. Don't cheat. Good luck. And do those purpose games. I think they're really helpful. And just like last time, there's going to be that matching portion where you have to look at pictures and tell me what it is that I'm labeling. So definitely do the purpose games in addition to watching this review. Watch this review, know the material in here, but definitely also study the purpose games. And like I said before, the pictures in Phonation 2 and Phonation 3, know the muscles, know the ligaments. And if you know all that, you are totally ready for it. Okay, good luck. If you have questions, send me an email. All right, that's it. But I can't stop the video right away because I have to Alt-Tab until I get to OBS Studio. So I'm just going to talk until I can click the button. Okay.